Mr Dawson.
Thank you, my lady. Professor, we will get back to the messages that we were talking about in just a moment, but there's a question just returning to an area we covered earlier. It's just an extra question that I forgot to ask you, if I could return to that. You were telling us about your views connected to the strategies adopted in the United Kingdom and in Scotland around the early part of the pandemic. In particular, your views in relation to things that could have been done to enhance the containment strategy that you think were not. Are you aware of any steps proposed by the Scottish Government for more aggressive strategies in those regards, but which were rejected by the UK Government prior to the first lockdown?
I'm not aware of that, no.
Just to be fair to you, you were not involved in the advisory group at that stage.
No.
But you were, I think, you had had correspondence, for example, around the middle of March that we've seen with the then Chief Medical Officer, a letter, I think, written by yourself and some colleagues at Edinburgh University. So you took an interest in the subject.
Yes, so I think that was, March 12th, 13th is when the decision was made to abandon containment. And that's when several colleagues and myself wrote a letter to Dr. Calderwood outlining our concerns with that. We didn't receive a response. Several days later, we sent an even stronger worded email with respect to the challenges she was facing, but just not understanding that move, and tried to emphasize that we needed to shift at that point. So that was 14th and then the 17th of March.
I'm not going to take you to the detail of that, Professor, because I think you've set out many, if not all of the points of view and concerns that you expressed in that letter in your evidence already. But there was just that particular one aspect I wanted to follow up on. If I can return then to the messages that you were telling us about that you shared with the First Minister. I was interested to know about why and when it was that you had produced these messages to the inquiry. My understanding is that these messages were provided by you in a bundle from, these are direct Twitter messages as I understand it. They were produced to the inquiry on the 7th of December 2023, is that right?
Around then, yeah, I wouldn't
Yes,
know exactly,
there was I think a slight confusion about the messages actually ultimately getting to the inquiry, but can we just put that aside for one moment? That's not a matter for you. Your witness statement was dated the 25th of October of last year, sorry, and therefore these messages were produced sometime later than the statement had been provided. Can you tell the chair of the inquiry why it is you produced those messages at that time?
Well, initially I'd been asked about informal communication, specifically WhatsApp groups. I was not part of any WhatsApp groups, and I went through the channels the Scottish Government had for informal communication, which was Slack, and then Teams and Zoom messages, which I had assumed had been held. And it was only a bit later when watching the proceedings happening that I was thinking, is there anything else? And I hadn't been asked about Twitter at all to that point. I'm very active on Twitter, and was thinking, could those be? Because in the questions I'd got was specifically questions around my communication with the former First Minister, zooming in on that. And so I approached the Scottish Government and said, would these be relevant to the inquiry? And they said, yes, they would be. And then I had to figure out how to download them, because you can't download Twitter DMs. You have to screenshot it. So it took me, I had to do all those. And then I did send them immediately over, and hopefully in time for this. It was not meant to hide anything. It was just, I didn't think of it because it wasn't asked of me, and WhatsApps were focused on, and I wasn't part of any of those groups.
So was the production of the messages was on your own initiative and not instigated by anyone else?
It was me thinking, is there anything else that's relevant related to this? I have to also admit that I had forgotten about them. If you see, the last one was dated, I think, 2020, if I'm in there. And this is 2 years ago, so I didn't even really fully understand what was in there. I had to go search and then go find those back there.
Just thank you for that. Just to clarify, you mentioned the use of a particular medium for communication there, which is called Slack.
Yeah.
Some of the information that we have indicates that a number of the academics like yourself, members of the Covid-19 advisory group, would communicate up-to-date scientific information and views on that through Slack. Is that a correct interpretation of the way in which that particular platform was used?
Yes, I think it was introduced because we had too much email traffic. So people wanted to share a new research paper, and it was clogging people's inboxes. There was just so many emails. And so the view was made that if you wanted to share things, share it on Slack to try to avoid the email traffic for when you wanted to post a link to something or a thought, or they wanted feedback on something. So it was to try to make it more coherent, I guess.
And did that discussion simply involve the academics, or was that a forum on which discussions also involved senior officials within the Scottish Government and/or ministers?
I don't know exactly who was invited to it. It was like a link to an app that you'd go into. I think definitely everyone on the Scottish Government Advisory Group was on it. So that would include probably the CMO, the National Clinical Director. I can't remember seeing any ministerial posts, but I don't know who was invited onto that channel. It's kind of like I don't know if you've used it before, it's like a website where you kind of just post stuff to, and people who click that link to that workspace can go in and see it. So I don't know who else had access to that workspace, if that makes sense. I would just go on and kind of read what was posted and then respond if I felt I had something useful to say.
But in terms of your broad recollection of how that was used, the active traffic was discussion amongst the academics rather than involvement of Scottish Government officials or ministers?
Yes, it was active discussion around papers, ideas. Yes, and it was because it was kind of a group mechanism. I think it was probably 100% work related. It was used like that for that purpose.
Indeed, thank you. Could I then look at INQ 000398982? This is the bundle of Twitter direct messages that you just referred to, that you provided to the Scottish Government initially near the beginning of December and subsequently came to the inquiry. Is that right?
Yes. Yep.
And is this all of the messages that you have retained between yourself and the former First Minister, either on this platform or on any electronic platform?
Yes, we also had emails, but I've submit those emails as well to the inquiry.
So just to be clear,
we did not WhatsApp. That's
insofar as you mentioned earlier, and I think one can see from the body of these messages, that you refer sometimes to policy papers which you are informing the former First Minister you have contributed to or you have prepared yourself or with your team, and you wish to bring them to her attention for some reason. And it is your position from your earlier evidence that as regards those policy papers, those were always submitted by other channels through email to the Scottish Government. Is that right?
Yes. Yeah.
But as regards any other conversations, those were not submitted. The content of those conversations was simply limited to the Twitter direct message exchange.
Yes, and phone conversations as well, because we would often speak by phone about different issues. So yeah, this was kind of like the sharing of me trying to highlight like paper going in on this or that, her saying, yes, send it to my email, going into the email, saying I'm a bit worried about that, and then the phone conversations would supplement it if it felt like there was further expansion needed on a policy paper to understand it fully.
Right. So the messages that you helpfully provided here are dated between the 16th of May 2020 and the 17th of December 2020. Is that the period over which you had direct contact with the First Minister, or was there a longer period over which you had contact with her connected to the pandemic response?
So there was contact before this, as she said, through the advisory group. We had deep dives where we would meet ministers, including herself, to explain evidence. I think you'll have the dates for those. So I had contact with her through that. And then after this, December is when the vaccine started to roll out. So actually, though there was challenges going into 2021, it didn't feel as acute and as dire as 2020 did. And so you'll probably see also the email traffic basically petered out at that point, because we were moving to a post-vaccine world, and the challenge there was around getting vaccines out, getting uptake, new variants, and so our communication wasn't as relevant in that point. So no, we didn't. I mean, we kept in touch, I guess, by phone, but it wasn't the same level of intensity as the emails also show. I'm
just interested, obviously, on the extent to which you're communicating about the COVID response, not about anything else. Yep. So did the contact between you and her continue after that period, as far as you talking about the pandemic response was concerned? No. So this is the period that we need to be focused on if one were to wish to know what it was you were discussing.
Yes.
This series of messages we think is helpful in highlighting a number of the important events that were happening over this period. This is a particularly important period, as it happens, when lots of things were happening and lots of decisions needed to be taken in which we are interested. So following the messages through is an interesting way, I think, of trying to elucidate some of the positions that were being taken and some of the decisions that were being taken too. So we can see the messages start on the 16th of May. If we go over the page, this is an exchange between you and her. You referred on the first page to the advisory group through which you had the previous contact at deep dive meetings attended by the First Minister, which you already told us about. You give her your mobile phone number in order to offer her support in connection with the response. Is that correct?
Yep.
Just to be clear, you didn't exchange any other messages with her, although she had your phone number, by any other media, for example, text messages, WhatsApp?
Nothing that I've retained at this point that would be relevant to here. We had, I'm trying to think, we were not on WhatsApp groups, and we did not have any direct one-to-one on WhatsApp, but I would say all of our communication relevant to the pandemic was through here, email, phone conversations, and then the deep dives. So we had kind of 4 different channels to do it on. And yeah, I don't think even till today I've had a WhatsApp conversation with her.
Just to be clear, thank you, as you'd exchanged numbers. As regards the telephone conversations, which you've explained as sometimes being around the content being discussed here, were, as far as you're aware, records of those telephone conversations ever retained?
They were not retained on my end. They felt to me not quite casual, but it'd say, okay, you've sent this paper in, and then questioning around the evidence behind it, why I thought certain things were true. And sometimes, and this is where the comment around the personal trainer came in about mental health and about how are you coping? This is really difficult. And that's when I talked about exercise. So that's why that came in. I think it was really just an expansion on papers to try to understand. I think she really wanted to understand the evidence and the data and what other countries were doing, and if Scotland could learn from those countries to do something better. So a lot of the questions were around who's doing this well? Who do you think's testing well? So I remember talking a lot about Denmark because they were testing 4 times as much per capita as Scotland and managing to keep schools open. So that was kind of the tone of the conversations. Thank
you. And as regards the personal trainer comment, just to clarify that did the personal training aspect of things mean that you had contact with the former First Minister, either in person or via Zoom or whatever, for that purpose? No, so I should say I've only met her twice in person. Both have been formal meetings that have been logged in government buildings. In my book, it was a throwaway comment because we had a conversation about how stressful it was. And I asked her, are you getting exercise? Which is a weird thing to ask, but I was just saying, how are you coping? Yes. And because that's how I coped, was exercise. And I said I was doing my PT certification. She joked she needs to do more exercise. And I said, you can be my first client. It'll help me build my base. And so that was the tenor of it, right? It was a joke, which I put in. Nothing's come of it. I haven't had any sessions with her in the park or anything like that. Thank you. That was the context. Thank you for clarifying that. We may actually return to discuss a little later some of the stresses on all of those who were involved. This is a subject I'd like to look into with you as well. On page 3, please, you see on the 17th of May that you mention a few recent articles where your words have been twisted, you find it frustrating. She reassures you and says, I fully understand how the media can twist words, sometimes deliberately. I think what you say is very powerful and clear, though, and has had a big influence on my thinking. So this is the First Minister indicating to you, she's giving you some reassurance, but also indicating that the views that you have expressed through various media, you were on TV, you wrote an article regularly in The Guardian and in other newspapers, I think sometimes, and of course through the formal channels that you've mentioned, the deep dive meetings and everything, had been influential in her thinking. Yep. And I have to say on that, it was a challenge because I did lots of interviews, and I did it with the best of intentions of trying to share information, let people know what was happening, and sometimes you got it reported straight, and sometimes what you said got convoluted into another message, and it became really tricky because I was trying to be in an advisory group, stay in the room, stay involved at the same time, trying to do media work.
And it was often a very impossible balance to have both in a way.
Thank you. There's a theme which is recurrent in these messages, I think, that you are almost apologetic at times about the fact that you had tried to convey a particular message and it perhaps didn't come across exactly the way you had intended. Would that be fair?
Yeah, and I admit I was quite naive on that. So you could give an interview for 20 minutes and explain things in great complexities, as academics can do, and then something will get pulled out and become the headline. And then when she would go into a media briefing, they would say, so-and-so has said this, which would sound ridiculous in that context. And I was like, no, that was in the context of a 20-minute discussion. So I did struggle, which we can come to, I guess, later on, with how do you engage with the media as an independent expert, where you're trying to convey messages, and we'll come to it on schools, where I thought we were very aligned on schools and what we were trying to do with schools, but often the media would try to say, oh, she's being pressured into saying this, or she's saying that, and it was hard. And I say media because there's all kinds of journalists, and I think some are looking to really try to get to the core of what you're saying, and some are trying to create a headline, which will make it difficult, in a sense, to keep relationships where you're trying to say, we're all on the same team here. We're trying to get through this pandemic. We're not trying to fight each other.
Can I, as I've tried to do with other witnesses, try to contextualise this particular period, just so those who are listening are aware of what was going on at this time? In Scotland, by this time, we'd had the month before the framework, the Four Harms framework, set out as Scottish Government strategy towards dealing with the pandemic and eventually coming out of a lockdown. Is that right?
Yeah, around 17th May, we were trying to emerge.
That had been in the recent past. And in May, one of the major things that happened was that the Scottish Government had set out its route map, which built on the Four Harms document, to try and exit lockdown. Is that broadly speaking your recollection of where we were at this time?
Yeah, broadly. I mean,
Yes.
I haven't looked back to what, I don't even know what I was referring to here, but
Yes.
I'm guessing that's that time period, yeah.
So you discuss, we're looking at page 4 here, you're discussing here with her, you say, thanks for your leadership. Just to note that small room to manoeuvre, estimated 1,000 to 2,500 daily new cases, sobering to see those figures after many weeks of lockdown. And while outdoor activities generally feel safe, feels like public sees this as lockdown lifted, and all that comes with outdoor activities, transport, food, toilets can increase transmission, fragile situation ahead. To which the First Minister responds, yes, I agree and feel very anxious about it. We will continue to be very tough in our messaging and won't be going any further than this for now. Over the page, I've been worried for the last couple of weeks that public already ahead of us on outdoor activity, and so formally allowing some of it at least enables us to try to put some rules around it on transport, distancing, etc., that many will follow, but yes, fragile. Many thanks for your continued advice. And you say, yes, I can understand that. As much as Scotland can chart its own course and develop its own testing, tracing, local data systems and public health response, the better. England is going a dangerous path on Monday, and with even its science advisors speaking out now. I wonder if you can help us contextualise where we are here a little, in the sense that you are, there is a degree of caution, I think, on both of your parts at this time. This seems to be quite a pivotal moment. Is that correct?
Yeah, of course. I mean, we were facing, if you remember at the time, across Britain, thousands of deaths a day. Health workers were at, burning out point. And it felt like England was just trying to lift very quickly without having the structures in place to make sure you could still suppress. And so it was worrying. And I probably have said the exact same to down south to people in England as well. So
your perception of, we've heard other evidence about what was going on in the UK government and what subsequently happened in Scotland at this stage. But your perception here was that your view was that the path that England was about to go down was the wrong path, and that you mentioned here that Scotland had its own powers to have certain systems within its control. Was your intent here to try and convey the message that Scotland needed to proceed more cautiously than the English plan had set out?
Yes.
Thank you. If I could just go over the page, there's some discussion, this is on page 6. There's some discussion there at the top. This is on the 4th of June, so slightly later, another exchange. I've done a note for the CMO. We're discussing in our Scottish group, that would be the COVID advisory group that we've referred to, on key steps to managing outbreak in Scotland looking forward. Happy to share a draft. Don't want to overstate or break protocol. What was your concern there?
I didn't want to be seen as overstepping in terms of actually sharing an actual policy document. I mean, in some ways, actually, if you read through it, the public communications I was doing seemed to be more influential on her thinking than what I was saying in the policy documents. But yeah, I mean, in some ways I am new to how things are run here, and I didn't want to be seen as breaking some kind of rule and being like, no, you shouldn't do that. So that was why I asked.
Yes, of course. To which she says that would be very helpful. Don't worry about protocol. Tackling the virus more important than that, and I'll handle any issues on that front. You can send it to me privately at, and she provides 2 addresses, one of which is an SNP address. Is that right?
Yep.
And which of the addresses would you use when corresponding with her by email in the way that you had said?
I would guess both, hopefully. I don't remember. I probably used one or the other. My sense anyways was both were being read by everybody. I mean, the notes I sent in were circulated, I think, among the top team. So they were not, I didn't think of them as private documents. I saw them as, once you email to that kind of address, I'm sending it from my university email, which is a public document as well. Yeah, so I can't recall, but I wouldn't have made a distinction trying to think, oh, that's a private route, that's a public route. I would have just sent it.
Yes, you didn't know any different between one address and the other, and there's no, she's giving you either to use.
Yeah,
I understand. So over the page, please, page 7, just the end of that message, you see it says, either was fine by me, either way fine by me, which I think is indicating either email address would be fine, is that right?
Yep.
And also for future use if necessary, you can contact me directly, and I think she provides there her personal mobile phone number. Is that right?
Yep.
Feel free to do so if you think there's anything I'm not aware of or not adequately taking account of or just getting wrong. I'm extremely anxious about the fragility of the position just now, so very grateful for any advice. Many thanks. So there, the former First Minister is encouraging you to get in personal contact with her to assist with the pandemic response, in particular in light of the fact that she, like you, sees this as a pivotal moment.
Yeah.
Thank you. If I could go to page 12, please. I should say, Professor, I am picking messages here which I think are of significance to the scope that we are looking at and some important exchanges. If there are any other aspects of this which you feel we should be looking at, I'm not in any way seeking to exclude any of the messages at all. I'd happily look at any of them, but I'm doing it for that purpose, to try and focus on things that are important to the way that we're analysing matters. If we go to page 12 of the document, please. You say, this is now the 18th of June, and you say there that you're working with a couple of other senior public health experts in Scotland on an exciting and feasible plan for elimination in July. We'll forward on as soon as it's ready. And then Ms. Sturgeon says, we'll be very keen to see that. Thanks. Now, as you might anticipate, what I'm interested in that regard is this is an early mention of the word elimination. We have talked with other witnesses about the extent to which, at around this time or slightly later, Scotland adopted a policy of what is sometimes called elimination, sometimes called zero COVID, and I'm interested in understanding what your role was in that. Mm-hmm. Broadly speaking, is it fair to say that you were keen on pursuing elimination?
Yeah, can I explain the logic
Absolutely,
of the time?
Please do.
Okay, so we're in summer 2020. This is June. We've just been through months of a very harsh lockdown to get numbers down, and we are starting to see a move from community transmission to clusters to isolated cases with handful of cases out there. In July, going forward from this, we had no deaths from COVID for 2 weeks. We're facing days of testing, finding 4, 5 cases, 6 cases. Alongside this, we've had antibody studies released around then, which showed that roughly 5% of the Scottish population had been exposed in the cities. So in rural communities, island communities, that's probably 2 or 3%. So we've already faced a huge death wave, a harsh lockdown. We face the prospect, if numbers go up, of a large susceptible population. Most people have not had COVID. And we also know by this time, vaccines are on the way. The UK government is contracting with Pfizer, AstraZeneca, Moderna, Sanofi. I can go through them. There's about 8 contracts out. And these vaccines are showing promising results. By that point, we had promising results in animal trials. I think phase 1 had been finished. We were into phase 2. And so in my mind, and along with colleagues, was we could have a vaccine within months, and that could save thousands of lives. And we are so close to actually being able to eliminate this. And to be fair, my colleague, Dr. Kenny Bailey at the university, did genetic sequencing studies and showed the first strains were eliminated. Like, we did it in Scotland. The problem is we re-imported new strains. And so that's why the note we did said, and this is maybe a mistake I made using the word elimination. If I'd used maximum suppression, we probably would have gotten alignment. If I hadn't said zero COVID, because I understood zero COVID as how we talk about in global health, Vision Zero, that's Sweden's approach to road traffic deaths, stop TB, end malaria, zero, stop TB. We use these titles and campaigns to say, we don't accept a spread of this disease. We try to deal with it and reduce it. And so that was what I was trying to convey. It was saying that we have a chance here to hold and wait for a vaccine in an optimal position and actually have a payoff from the sacrifices made and avoid a winter lockdown, which is what we were facing. It was clear if numbers went up, there was enough people susceptible, we would repeat that same mistake we had in the first wave. And I know it's been heavily criticized. People say it was, blue skies. But the truth is, for me, elimination was an elimination strategy. How do we drive to zero? And I have to say, at that time, the debate in England was about an acceptable number of cases and staying within NHS capacity. Let's just kind of float cases. And that seemed to be egregious given we had a vaccine around the corner. And I will say, looking forward, because I've been involved in that for lessons learned, that I don't think anyone is talking about living with avian flu or living with whatever it might be next, a MERS outbreak. The whole focus now is what's called the 100 Days Challenge. It's within 100 days that you have a vaccine, a treatment, or some kind of therapeutic. In the United States, that's been translated into 130 days till the entire US population is vaccinated, and 200 days till the world is vaccinated. That's where the US government planning is going. And so in that 100 days, nobody is saying we should accept spread. They're saying maximum suppression we need to hold. So I understood when COVID emerged, there was debates over will there be a vaccine, that maybe at that point you could have accepted spread. You could have said it's inevitable. It's a disease and it's gone. But to accept it when you knew vaccines were around the horizon, you knew the deaths that entailed. And I worked on schools, we can come to that very closely. You knew that we had to get kids back to school, keep them in school, and that meant keeping COVID at a low level. It felt like this was the time to push for it, and it seemed feasible. And if you read the elimination plan I put together, which I've submitted and went through the entire advisory group, it wasn't saying lockdown, didn't even mention the word lockdown. What it mentioned was extensive testing. We had a lot of unused testing capacity in Scotland. So I was like, we should be testing much more. It mentioned borders and imported cases and travel and tourism and worries about the return of the university. And it mentioned cohesion across the four nations and actually getting England to come along with this plan, which was the main barrier at that point. And so I think when people say, oh, this caused indefinite lockdown or this caused harms, that wasn't what we're saying. It was trying to capitalize on all that we had done to get to such a good position. And that's why when the winter wave came and the winter lockdown and the numbers went up, it was predictable. And it was really depressing because in January, vaccines rolled out and you think how many of those people would have lived had they just been able to delay infection by 2 months, a month. That was how close it was at that time.
So your position, thank you for that. Could I make repeat my plea on behalf of the stenographer?
Oh, slow.
And also, frankly, on my capacity to take in what you're saying. But if you could just speak a little more slowly, I very much appreciate that. So your position at this time was that zero COVID or elimination was the goal, and you thought it was achievable. And I think you said that your colleague has demonstrated, as far as the original strains were concerned, the original strains were eliminated. So,
yes.
So Scotland did achieve zero COVID by that standard.
Yes.
Yeah. Mm-hmm. There is, I think, a potential issue around the question of the language used of elimination and zero COVID, in particular the way in which that is released to the public. And what the perception of that might be. Do you think it's fair that, well, first of all, did you understand it to be the policy of the Scottish Government at this time to aim for zero COVID or elimination?
Not in their what they were actually doing? No, right? Because we didn't have any checks on cases coming over. We had no cohesion with England on a plan. And so I think it was nice to have this message to say as low as possible, let's push incidence down. I don't think anyone would ever say publicly, we adopted a zero COVID plan. And I have to say that was a mistake, and I'll hold my hands up. I think whenever I said zero COVID, people would say zero cases of COVID. And I said, no, we're trying to reach a world of zero COVID, like we try to reach a world of zero cancer or zero road traffic incidents. It's saying we don't accept and live with diseases and causes of death. We try to reduce them. Elimination as well, because people would say elimination's impossible. And I'd say, okay, it's an elimination strategy. And they wouldn't understand that. So I'd say, okay, maximum suppression. So if you read through these, you could see I changed my language to, we're all talking about the same thing. It's just different language. And I would have said maximum suppression, which is get those cases down and communicate to the public that we are doing this because vaccines are on their way in a matter of months. And that's the messaging I tried to do as well to people. Postpone Christmas by a month. You'll have many more Christmases in the future. But it didn't come across, I know, in that language.
So ultimately, zero COVID or elimination was a target, an aspiration. And even if it were not achieved, if efforts were made towards it, it would achieve suppression of cases in the virus, which could only be a good thing.
Yeah, shoot for the stars, right? And you try to you save as many lives as you can. And to be fair, the countries that have come out well in terms of their excess mortality, as well as their stringency index, as well as their economies, did go for maximum suppression, which I'm saying why in the future going forward, the template that governments are using, including Britain, is this 100-day plan, which is we assume in 100 days we will have some kind of breakthrough. We're preparing mRNA platforms, diagnostics. We have so many ways to create tools. And then the question becomes, what do you do in those 100 days? And how do you avoid the loss of freedom, the loss of livelihood, school closures in those 100 days until you have a product? So this was, I guess, my attempt at trying to bring this into the discussion. And I wasn't alone, to be fair. I mean, there were colleagues across the world who were also saying, you're not a Dhaka, you're not a Seoul, you are Scotland, you're 5.5 million people, your biggest city has 600,000. In the context of the world, we are a small country. We are a high-income country. We have good economic security nets. So in global health, we are in a privileged position. So that's the way I was seeing it, though I can see it was not a long-term plan to say no more COVID forever. It was, let's reduce COVID until we can roll out a scientific breakthrough.
Could we look at the statement, please, at paragraph 142, just to jump away from this at the moment?
Yep.
Page 23. And you tell us there, around about this time, slightly after the message you were looking at, on 30th of June 2020, I was quoted in an article titled, "Scotland could eliminate coronavirus if it were not for England." In this article, I offered my opinion that there seemed to be two different approaches to managing COVID-19 in England and Scotland. The Scottish strategy seemed to aim for maximum suppression while keeping cases of COVID-19 at really low levels. England's approach appeared to be to keep COVID-19 within NHS capacity and try to get back to normality as soon as possible. In other words, Scotland was looking to suppress COVID-19 until a vaccine was available, and England seemed to be focused on how to live with COVID-19 before mass vaccination. You mentioned a moment ago the difficulties there were in achieving consensus.
Yeah.
Did you think that this article and your contribution to it helped in that process?
No, it didn't. But I should say that when you talk to journalists, you don't know what actually the title's going to be. You don't know what you're going to be quoted on. You don't know what's going to be in it. And if you actually take away the title, and I went back to read the article, I actually was emphasizing that we needed to have cohesion across the approaches. And if I'm honest, I was really frustrated with not understanding England's strategy because we are linked together. And so it just seemed to me so clear that given the levels of immunity, given the level of death, given that we didn't want to have another lockdown, which was catastrophic in terms of the harms that raised, why you wouldn't go for maximum suppression and just try to kind of simmer COVID within a level. It just doesn't work when you have such a large susceptible population. So, yeah, I mean, you could make a a whole book about all my missteps with journalists and articles and media coverage. But I guess the point was being, we didn't have consensus, and I really felt we should have consensus because it seemed clear to me what should be the steps going forward.
I think the messages show, without going through all individually, please tell me if I've got the wrong impression, that one of the subjects you discuss regularly, although the messages are relatively irregular, with Ms Sturgeon, is the very fact of the difficulty at arriving at some sort of consensus, even putting some sort of four-nation effort into a slogan as to what we're trying to achieve seemed to take months. So you were aware that there was no consensus, and indeed your interpretation of your contribution to the article indicates that you were aware of it. As a result of that, was it not your assessment that it was inevitable that zero COVID, understood in the sense of there being no COVID at all, was unachievable in light of the lack of consensus?
Yes.
Therefore, does that mean that if people do you think it was reasonable that people took the impression when zero COVID or elimination appeared in the media that what Scottish people thought was that meant COVID is going to be over soon?
Maybe. I don't know how it's interpreted. It wasn't. Maybe we should have communicated it better that we're trying to suppress until a vaccine. And I think if we had, hopefully, not in our lifetimes, but a future pandemic, that is the language that you'd give. You'd say, imagine avian flu starts human-to-human transmission. You would say to people, we are trying to keep this at very low levels. It's very deadly until we have a scientific breakthrough which protects you from this. And maybe that should have been the language in the summer. I think we got there in November. If I remember then, the messaging was around the vaccines are coming, hold out. But it was very difficult in that period because the messaging was get back to the office, get back to normality, eat out to help out, all these things which try to give people a sense of, the problem is over, where I was actually trying to say the problem is coming this winter. I mean, that was the worry, a winter lockdown, which is what we were trying to avoid. And a winter lockdown would be triggered by the NHS getting overwhelmed. The NHS gets overwhelmed if you have too many people infected with COVID, and too many people get infected with COVID if you have no testing in place and people mix and you have a susceptible population. So it's just a logical kind of backstep of how do we avoid this working backwards. And so, yeah, and I think in terms of learning lessons, we should be learning not only in terms of the lives lost, but how we avoid those kind of lockdown measures. And that was part of my learning is like, how do we do both? And okay, this is a way we can maybe do both for the next couple months.
In circumstances where, if it were to be the case that people in Scotland thought that message meant that COVID was over or was about to be over, do you think that it was predictable, if people thought that people might think to themselves, let's go out to the pub, let's go to the restaurant, let's book that Spanish holiday?
Yeah, that might have been an unintended consequence. Obviously it was not what I intended or wanted to happen. I think it was the idea of we have a window of time where we can contain and have a breakthrough. And if you go back to that letter I wrote with colleagues to Dr. Calderwood in March, we do mention vaccines. We say in that the first trials have started. I'd worked before that with CEPI, with Gavi, the Vaccine Alliance. There were about 200 trials that started in January. And by April, it looked pretty good. I mean, by that summer, Sarah Gilbert, one of the people who created the Oxford vaccine, was saying 80% effectiveness. So for me, that was like, oh my goodness, we're going to have not one, but multiple vaccines. Sputnik, the Russian vaccine, was approved, quite soon after that summer. So I think that's where it was really coming from. And everything, it was that we have a chance for a scientific breakthrough. And we've done this. Humans are remarkable at finding scientific solutions, whether it's HIV, measles, malaria, polio, smallpox. You can go through the range of things we faced. We have found some way to defang them or make them less deadly. And so when we knew that was around the horizon, to try to get back to normality seemed to me wrong. But then you're saying, I guess, zero COVID might have prompted people to get back to normality. So it was an unintended consequence if that was what happened. I would never have wanted that, clearly.
Because we do know, at least as regards my reference to the Spanish holiday, that the second wave was predominantly caused in Scotland, if not exclusively caused, by people who took holidays, in particular to continental Europe and Spain, because genomic sequencing has shown that the variants that then became the drivers for the second wave were ones that originated in continental Europe. Isn't that right?
Yeah, and I did do a New York Times piece that summer saying we're going to pay for our summer holidays with winter lockdowns. It's exactly the title of the piece.
Exactly.
And the point being that what could we do about it, though, right? So you're thinking, okay, we could have tested. I think that the main challenge, I think, is we didn't accept there were trade-offs. There were trade-offs in a pandemic to try to save lives. Some countries traded off privacy. That was South Korea with their testing and tracing. Some traded off international mobility through closing their borders. Some traded off, you could go through it. And it felt like here people wanted everything, and they were angry that they didn't have everything. And so my point is, okay, if you have to put brakes in the system to slow this, where would you put the brakes? You don't want to put them into schools. Kids need to be in school. You don't want to put it into even people's livelihoods, pubs, daily life. That's the bulk of the economy, consumerism. And so I thought, well, where would you put the brakes in is airports and travel and borders, which is why I was talking about that issue, because I thought, yes, there's reduced international mobility, but there's reduced international mobility anyways because everyone stopped traveling. So the airlines are anyways hurting, put in place testing regimes, and they were asking for that as well. I mean, you probably have the evidence from the Parliament Committee I did on travel, and actually airports and airlines were asking for testing regimes, for more kind of alignment across countries about travel. And so that's a real shame looking back to think we had that window of opportunity and we didn't act on it, a way to avoid a winter lockdown. I just thought, wouldn't you rather have kids in school, be able to go about your daily life and have all that? But if you want to go abroad, it's a bit more difficult for a few months rather than have what we had, which is kind of like the NHS at breaking point, health workers burning out, thousands of people dying, and you end up in a stay-at-home lockdown. It's like the whole system collapses if you didn't make that choice early on. So that was kind of the logic, at least my thinking going into it.
Thank you. There isn't a lot of discussion around this time, and the messages go on along this vein. You're pushing your view of maximum suppression or elimination, whatever you call it, and that is it fair to say that that was a message to which the former First Minister was very receptive?
Yes. She could see the logic.
Yes.
I mean, I laid it out as logically as I've tried to here. And we all wanted the same things. And I do believe she did want the best for as much as she could control for the Scottish and the British public of trying. No one wanted to see the deaths.
Well, you mentioned as much as she could control. There isn't in these exchanges, from what I can see, trying to read it as fairly as possible, an awful lot of discussion about borders. You've mentioned the fact that borders might well have been something, or would have been something you should have done if you were pursuing a maximum suppression strategy, and that didn't happen. And I think we're agreed on the fact that that was the major contributor to the second wave, which is precisely what you were trying to avoid. Why is it the case that you weren't saying very much in these messages about borders? Was it because you understood that was not within the First Minister's control?
Well, that's what I understood. And also we had a land border, so people would just fly into Manchester or Newcastle. I mean, the idea that, we've already seen it, I talk about this with the whole red list. If someone is flying, for example, into the States from China, they couldn't fly. This is what former President Donald Trump did. What they would do, they would just connect in Europe and they'd fly from London. Then they're not flying from China. And so I guess the point being that without England coming along and saying, oh, actually, yeah, we like this plan, let's do it for the whole island as a whole, it would be impossible if you just limited Edinburgh, Glasgow, the major airports here, all you do is drive traffic into England and people would just take the train up. So that was, I guess, the logic. But if you look at the actual elimination document that I mentioned, we do mention borders quite there. And I did mention it so much that I was called xenophobic at points. And so I think, if anything, I probably overstated the case. And I was saying, no, it's not xenophobia. I mean, who am I to be xenophobic? I'm a foreigner in another country. It was more the point that where do you put brakes in the system to slow and delay spread in the least harmful way? And for me, the airlines were anyway suffering. I don't think many people were traveling. They were trying to stay home and stay safe. So how do we go into autumn in the best position possible? And schools, in my mind, very, very apparently that we wanted to keep schools open, which meant we had to have levels of infection quite low.
Should the Scottish Government have done more over this period to try to work towards your goal of maximum suppression?
Yes, I would say. I mean, I think in the messages with the former First Minister, you can see she was aligned on it and she was trying to push it from what she says in those messages with Cobra, with those down south. I was trying to push it down south. I had meetings with Patrick Vallance. I wrote Chris Whitty. I went in front of the COVID recovery group and made the case as well for why I thought this was the best for economic recovery for the country. So I think, in a sense, I did what I thought I could do to try to advocate this and put the logic forward, but I don't know where it went once it goes into that system. I brought it up in the COVID advisory group multiple times where it was debated, and yeah, maybe that is a lesson. If you think I should have done something more, I can learn from that, but I felt I did what I could to kind of get the message and the information and the data out into the system, and then you kind of have to let it go because that's in the end a political decision. That's beyond me.
As far as the Scottish Government's actions are concerned, am I correct in understanding your evidence that what it should, in your view, have done more is done more as regards the border, the external border, if it was competent for it to do so, and done more testing over this period? Is that right?
Yes.
And are there any other things in the strategy that it should and could have done to try to pursue that strategy more than it did?
I think we needed to have more cohesion with England. I didn't think it makes sense to have us going in such divergent approaches. We needed to have some kind of consensus that we're all going towards the same goal, at least, and the same kind of on the same time frame.
Yes.
So that I think was a challenge.
Thank you. To move away from the messages and this for one moment, there's one other area I'd like to cover with you. In both your book and your statement, it's at paragraph 186, you explain some of the experiences that you had in your role as a public figure who provided media in relation to the COVID response, but also your role as an independent expert advisor. And in the book and in the statement you say, paragraph 186, I am passionate about my work in global public health, and I felt I had the correct expertise to contribute to a more effective response. However, it did come at a major cost. All members of the group contributed a significant amount of time on a pro bono basis. I also have been subject to public abuse, death threats, and online conspiracy theories. I was interested to try to understand what those experiences must have been like, in particular in the context of the responsibility of this inquiry to try to consider recommendations as to how to encourage people like yourself to be part of advisory groups on a pro bono basis, as you were, to try to maximise the efficiency of any response to a future pandemic.
Yeah, it's a tricky area. I've thought about this a lot. I reflect on it in my book because I got involved because it was literally about life and death. I got onto the media at a time when I felt that people were confused, they didn't know what to believe, and I knew what experts were doing. Experts were moving their families to remote islands. They were moving to country homes, and they were pulling their children out of school, and they were protecting them and themselves and their loved ones. Yet that message wasn't reaching the public. It seemed to be this divide between what, not just here, around the world, experts were doing to prepare, and what the general public knew, with governments underplaying it. And so, yeah, I stepped up and I tried to provide honest information to the public on the risks, on what we knew about it, on what other countries were doing. I tried not to be alarming, I tried to be always factual, but I felt they deserved the same information that we had and the same chances of protecting their loved ones. And it's not, I should say at the time that people did think this was something just about the elderly, and it wasn't. I mean, in the United States, a quarter of the people who have died are under 65. I have had people my age die in India because they couldn't get to hospital to get fluids and oxygen. This is a serious disease, and I felt like that was why I put myself out there. And it has been rough. I won't go into it too much, but I have gotten death threats. I've had racism, sexism, homophobia, you name it, xenophobia. And I've taken it because I think the bigger idea is that we try to help each other and do good. And I stay true to that. But it's not about me anymore because I lead a team of researchers at the university, postdocs, PhDs, masters, about 75% are young women. They don't want to go near government service or the media. They've seen too much. And it makes me sad because I've done my tour of duty, I've done my service. My book ends by saying, I'm on to my next things. But who's going to step up next time? And I don't think seeing how it's gone that others will be willing to do it because the cost is high and the benefits are low. Academia is oriented around the grants you bring in your research income, your teaching, and your publications. What are your citations? That is how you get promoted. That is how you make your career. Sitting on government panels is seen as, great that you've done it. Media work is completely seen as irrelevant, I would say. And so why would you do it, given the costs involved? I did it because we were in a pandemic and people were dying, and I just thought it was too important not to speak up. My sister also works on a COVID ward in New York City. She had seen everything before, we were hit slightly after them and all of that. And I just felt, you've got to speak up if you're going to speak up. But would I do it again? As I said, I don't know if I would, knowing what I know now. And I don't have solutions. It's not Britain specific. This is true, as I say in my book, of Netherlands, Germany, United States is even worse. There you're afraid of being shot. At least here you're only worried about being stabbed. And, Australia, the same. So I don't think it's British specific or UK specific. This is a general problem now. Also with the online misinformation where people can share something which gets shared 4,000 or 5,000 times and becomes the truth because it's been shared. I don't know what you do about it. That's, I guess, something I hope I'll learn from you guys because I'm pretty stuck on solutions. I can see the problem, I just can't see a way forward.
Thank you. Were you offered support by the Scottish Government to try to deal with these distressing situations in which you found yourself?
Yes.
And did you find that adequate?
I didn't take it up, actually, so I don't know what was there. I know it was always there, the offer was made, but I think in these kind of instances, you just have to kind of stick close to your values, your family, your friends. And as I say in my book, everyone I've met in person has been absolutely lovely. We can debate. I think that the line is we can have healthy debate over how you manage a response, what is acceptable loss of life, what are impositions on people's freedoms. But I think when it gets into mudslinging, name-calling, threats, hate speech, that's when it's crossed the line. And I think, unfortunately, in a democracy, you have the healthy debate, but then it moves into sometimes the more toxic elements of it. Most of us academics, we just want to be in our offices reading and writing, and for me, being out in the field. So I'll go back to that quiet life and kind of leave this, hopefully, for the next generation whenever we have our next crisis arrive and help.
That seems like a good place to conclude. Those are my questions, Professor. Thank you very much. There are some additional questions from core participants.
Okay. Ms. Mitchell.
I'm obliged to my learned friend who's asked a number of questions that Scottish COVID bereaved wished to be asked. I am instructed by Amar Anwar and Company to ask questions on behalf of the Scottish COVID bereaved. I appreciate it is difficult, but we're very much limited by time, and quite properly so. So could I ask you simply to try and keep your answers as concise as possible so we can hear what may be important answers to questions that you have. You wrote a Guardian article, I don't need it brought up, but for the inquiry it's INQ 335963. And in that article, you differentiated between the way the Scottish Government dealt with making decisions and the UK Government. And you said the Scottish Government's approach was different because in making the decision to bring critics into the room, this helped diversify the views and express and avoid groupthink. And I think we've already heard about your lively debates in that regard with someone else who was involved in the process. How were you aware that there was no one in the UK Government providing these critical views? I suppose I've listened to your evidence this morning, and in the same way that you were communicating directly with our First Minister, it's probably the case that other scientists were directly communicating with ministers down south. Might that be the case?
Yes, I guess it's me comparing. I was on a UK Cabinet Office advisory group, as well as, I was quite critical of both governments, I should say. I did an interview with Politics Scotland on the Sunday, I think March 14th it was, or the 15th, and was very critical about how things were going. And the difference I felt was that the Scottish Advisory Group invited me on and said, stop throwing stones and help us build a response if you really think you can help, which is a real challenge. It's easier to be outside throwing stones, I'll tell you that. And then on the other side, I say, push to UK government. I offered to come in to help. Colleagues did as well. I heard the evidence of other colleagues who've sat on stage in other groups, and they were kind of more blocked if they felt their message wasn't being heard. And so I feel that was the comparison I was trying to make, which is, I thought, if someone's saying that's going off, if you can invite them in and say, well, how do you think we should make it better? Then you actually at least get a healthier debate, where I felt that did not happen with the UK government. On the group I was on, it was very apart from decision making. We were several layers away.
Well, you may have been so concise you've answered my next question, which is, who were the critics in the room? And I suppose your answer to that was me.
Me and others as well. I mean, you're going to hear from others this week
Indeed.
as well that I know. So I think, yeah, it's a smart lesson in public policy that if someone's criticizing you, you get them to help build, because then you get a better response, and you also quiet them because they're responsible as well in terms of trying to do something better.
To provide solutions rather than just point out problems.
Exactly, yeah.
I'd like to move on to another question now. This is quite a broad question, but I am going to focus it much more because I fear that if I was to ask you the original question, I was granted leave. It's enough for a PhD. So in your evidence this morning, you've talked about mistakes at UK level, and I've noted quite a few of them. If I might highlight those, they include failure to look at other countries. You talk about a lack of humility, cynical fatalism, that we move too quickly from containment to mitigation, the issue of border measures. You spoke of the examples of other countries, Norway and Australia, limiting influx and testing. You said we were too late in pursuing the testing strategy, that our messaging to go and stop was perhaps not the correct communication, and also failure to have multidisciplinary fields working together. So I suppose cross-pollinate ideas. Against that background, I would ask you to consider, on the basis, I suppose, that this inquiry wants to learn lessons and see how it can do better in the inevitable next pandemic, what, if any, one mistake was specifically made by the Scottish Government in their handling of the pandemic that we could learn lessons from and do differently in the next one?
I think the biggest mistake was around testing, and that affects so many issues in the February-March period, that we didn't have a testing strategy, capacity, capabilities. I think that, and then linked to that, I would say, I'm thinking of what's kind of devolved, like NHS Scotland, they didn't have adequate PPE. This was a huge issue for at least like my medical students who were working on wards and didn't have appropriate protection. So I would say, I mean, the big lesson, and this is why the countries did start running with testing even from mid-January, is you need to have a testing system up because you need to know who's infectious. And if you know who's infectious, then you can avoid others becoming infected from that person. And I think we were very late in Scotland as well on that. I guess you'll hear about why, but that I say was the biggest failing in the early days. And can I also offer my condolences to the bereaved and those who have lost loved ones?
Milady, those are my questions.
Thank you very much, Ms Mitchell. That completes the evidence. Thank you very much indeed, Professor. Very grateful to you. As you may know, I've heard about the kind of abuse that experts like you have suffered from, amongst others, Professor Sir Chris Whitty, and it's dreadful. I know how distressing it must be. And as you say, the impact on people, why would they bother in future to help the country, help prevent future deaths? So it's absolutely distressing, and on many angles, but I'm afraid you can't look to me for an answer because I've had to put up with similar kinds of abuse and I don't know the answer. So all we can hope is that people like you continue to feel that public service is worthwhile. So thank you very much indeed.
Thank you.
Right, I gather I now have to rise because our next witness has COVID.
If I could just explain that the next witness is Professor Andrew Morris. He does indeed have COVID. Fortunately for our purposes, arrangements have been made for him to appear remotely. I understand that this means that there will be around 20 minutes to set that up, and we will return and hear his evidence.
Indeed, and I think one also needs to remember, having had COVID more than once myself, one does get very tired. I mean, one thinks one's going to be okay, and I gather the professor thinks he'll be fine. But I think we need to make sure that we really restrict our questions to those who are absolutely essential. Very well, I shall return. You can tell me 3:05. I think you are, yeah. I was hoping I might get away with 15 minutes, but I can't. 3:05. Thank you again.
Okay, thank you.
Thank you, Milady.
In our hearing room.
The next witness is Professor Andrew Morris, my lady.
Good afternoon, Professor Morris. Can you see and hear me okay?
I can hear you perfectly. Thank you.
Okay. I'm going to take you through the oath. If you could take the Bible in your right hand, please, and repeat after me. I swear by Almighty God
I swear by Almighty God
that the evidence I shall give
the evidence that I shall give
shall be the truth,
will be the truth,
the whole truth,
whole truth,
and nothing but the truth.
but the truth.
Thank you.
Professor Morris, I'm really sorry to hear that you've got COVID, and I imagine how you might be feeling. So we're going to take breaks that you've asked for, but please just say if you find that your brain is just getting fuddled, because obviously we don't want to make your condition any worse. So you're in control, okay? Just tell me when you need a break.
Thank you, my lady.
We will be taking breaks if you don't tell us, but just tell me if you need any extra ones.
That's kind.
Mr. Dawson.
Thank you.
Thank you, my lady. Can you hear me okay, Professor?
Perfectly. Thank you.
Thank you very much. If you have any difficulties with hearing me or documents, please feel free to say so, and we'll do the best we can to get through the evidence. You provided a number of witness statements to the inquiry. The first statement is dated the 14th of November 2023, INQ 000346264. It should come up on the screen in front of you.
I can see that.
That is your witness statement.
That is correct.
And as far as you're concerned, do the contents of that witness statement remain true and accurate as of today's date?
They do.
You also provided a questionnaire response dated the 17th of October 2022 under reference INQ 000056491. Is that your questionnaire response dated that date?
It is.
And do the contents of that document remain true and accurate as far as you're concerned at this date?
They do.
You also helpfully provided us with a Scottish Government corporate statement in your capacity as the chair of the Scottish Government COVID Advisory Group, dated the 23rd of June 2023 under INQ 000215468. Is that your statement in that capacity?
It is.
And do the contents of that statement remain true and accurate as of today's date?
They do.
Just like to run through some brief details of your history, Professor. You are a medical doctor.
I am.
You graduated from Glasgow University in 1987 and pursued a career in hospital medicine as a physician initially in Scotland and then in Cornwall. Is that correct?
That's correct.
Later, you moved you trained in diabetes and endocrinology, as well as clinical pharmacology as a university clinical academic. Is that right?
That's correct.
And you were initially affiliated to the University of Glasgow between 1990 and 1994.
That is correct.
And then the University of Dundee between 1994 and 2014.
That is correct.
And while at Dundee, you were appointed as a consultant physician in NHS Tayside in 1996, as Professor of Medicine in 2004, and laterally the Dean of the Medical School at the University of Dundee in 2012. Is that right?
That is correct.
And in 2014, you moved to the University of Edinburgh as Professor of Medicine and Vice Principal Data Science, and as an honorary consultant physician in NHS Lothian. Is that correct?
Correct.
Is it correct to say, Professor, that your main area of research has been in health data research since 1996?
That is correct.
I understand that initially in the field of diabetes, you built multi-professional teams who used information technology and data science, and that perhaps in subsequent years, your interest in data science has widened out to broadly across different NHS fields. Is that right?
That is correct.
I understand that you were seconded to the Scottish Government as Chief Scientist Health, a post about which we've already heard some evidence, for 3 days a week in between the years of 2012 and 2017.
That's correct.
In that post, you tell us in your statement that you led programmes that used data in a trustworthy way for the 5.2 million citizens of Scotland. I wonder if you could tell us a little bit more about your work relating to data in that position.
if one looks at the best performing health systems internationally, they are characterized by whole system intelligence, the ability to use data to optimize care, to improve public health, to manage the health service, to augment clinical trials, and also to perform new innovative research such as artificial intelligence. This requires seeing data as infrastructure. In my role as chief scientist, I worked with partners across Scotland to develop reliable and trustworthy data infrastructures to enable research at scale on up to 5.2 million people.
Thank you. When you left that role, having worked on projects relating to data in 2017, can you tell us whether you consider there to be issues in a broad sense with the way in which data was accessible relating to health matters in Scotland? And if so, what your understanding was of how those issues were being addressed?
So we'd made good progress in Scotland in many respects, and that was through collaboration and partnership between policymakers, NHS, academia, and most importantly, the publics. And that allowed us to create systems of what I call whole system intelligence. So we had made good progress in how we collect data, manage it, share it, link it, access and analyze it. And that was used not only for patient care, but importantly for biomedical research. However, in my view, we were still in the foothills of where we needed to be so that those data could be used in a far more agile and real-time way to derive new research insights which could improve people's lives. And I think this was demonstrated at the start of the pandemic, the need to have this data as infrastructure to create new insights so that information that was useful to policymakers and system leaders could readily be available.
By the time the pandemic started, did these issues with regard to the ability to be able to use data in an agile and real-time way still exist in Scotland?
I think in the pandemic, we saw in Scotland examples of outstanding international practice, but there were still issues in terms of the engineering of the infrastructure. If I may use EVE2, of which the inquiry has heard a lot about. EVE2 was a partnership between the University of Edinburgh and Public Health Scotland, led by my colleague, Professor Aziz Sheikh, and that derived whole system intelligence that linked primary care data, vaccination data, antigen status data, hospitalization and death data in near real time. And it created new knowledge which had influence internationally on pandemic response. However, to mobilize EVE2 took from the 20th of March 2020 to the 6th of August 2020. That was 137 days, and that was because there were 21 requests for approval required to actually mobilize the data and enable its access for subsequent analysis. So huge potential, but blockages in how, in a trustworthy way, with public engagement, we can use data at scale, essential for the pandemic response.
If, as I think you are, Professor, you are characterising that period between March and August 2020 as a delay, who was responsible for the delay in allowing access to the EVE2 scientists to that data?
So we have governance processes in place, which are right and proper, which review access requests for data. In this circumstance, because the governance processes are fragmented and data is controlled by multiple bodies across any UK health ecosystem, individual approvals had to be made to, I think it was 21 NHS bodies.
And that process limited the agility, to use your word, in accessing the data which was necessary for this important work.
Correct.
Could I just be clear with you, Professor, that when you talk about accessibility of data in this regard, are you limiting your comments to the accessibility of data to academic researchers whose work would assist and augment government response, or are there more general data collection and accessibility issues that apply to everyone, including those decision makers themselves?
I think these are generic issues. However, there is a greater emphasis for access to data for so-called secondary purposes, of which research is a criterion.
But that research could and did assist with the efficacy of government response in Scotland and indeed the wider UK when such access was made available through, in particular, EVE 2. Is that correct?
That is correct.
Sorry.
I would suggest what we saw in the pandemic was a unique alignment between policymakers, academics, the NHS and the public, and the very close collaboration and partnership working was essential if we were to understand this new and imperfectly understood virus. And the academic and scientific response was absolutely vital for the policy response.
And is it your position, therefore, that the alignment between these various sectors of the response would have been achieved better had important data been available to that important research at an earlier stage?
I concur.
Thank you. Since 2017, I understand that you have been seconded part-time to be the inaugural Director of Health Data Research UK, the National Institute of Health Data Science. I wonder if you could explain for us, please, what role Health Data Research UK played in the pandemic response.
Health Data Research UK is one of the Medical Research Council's 5 national institutes. It's a slightly unusual institute in that we have 9 funders from across the UK, including major charities like Cancer Research UK, British Heart Foundation, plus the health departments in the 4 nations. Its mission is to unite the UK's health data to enable discoveries that improve people's lives. In anticipation of the need for research and insight to support health system development, design, and productivity. At the start of the pandemic, HDR UK was a young organisation, only 18 months old, but it's as a group, as we work in collaboration with over 100 UK organisations, including 38 universities, was that there was a need to sort the data that was relevant to the pandemic. So the 3 things we did were firstly to map the data, which included testing, surveillance, healthcare, mortality, non-health data and vaccination data. Secondly, to convene the community to encourage collaboration so that vital research questions relevant to the pandemic response could be answered. For example, vaccine safety, efficacy, the the effects of the virus on different population groups. And lastly, we prioritised research questions to try to answer those questions as soon as possible. We were invited by SAGE to present twice on this strategy for health data infrastructure, and the outputs were over 330 projects with 230 scientific publications relevant to the pandemic in the UK and internationally. So we were a convener to try to work with bodies to sort the data across the UK, working in partnership with NHS, academic and other bodies.
Thank you very much, Professor. You were a member, as I understand it, of SAGE, which you've just mentioned. Is that correct?
That is correct, yes.
And you were in attendance at early meetings of SAGE relating to the pandemic response?
My first attendance at SAGE was on the 26th of March, 2020, I recall.
Yes. That was in the capacity, I think, as the newly appointed chairman of the Scottish Government's COVID Advisory Group. Is that right?
That is correct.
As far as you were concerned, we've heard some evidence about this already, but at the time when the Scottish group was created, was it expressed to you either by the Chief Medical Officer of the time, members of both groups, that there was a level of dissatisfaction about the extent of Scottish contribution, if one can put it that way, to the business of SAGE and its subgroups, including NerveTag, up to that point?
Those were observations that were relayed to me, yes.
And what was the nature of those observations? What were the difficulties that had been experienced up to that point?
I think my understanding is that early on, January and February, Scottish colleagues were observers on some of these groups, and a need was identified to enable Scottish policymakers and ministers to have more direct access to expert scientific advice.
The ministers presumably felt that they had had inadequate access to that advice, although, of course, there was very considerable expertise on SAGE and its subgroups. Is that a fair reflection of the position?
I think that is a fair reflection. The expertise and quality of discussion on SAGE and its subgroups, in my mind, excellent.
I would just like to ask you a little bit, some questions about the circumstances in which the Scottish COVID Advisory Group came to be put together, and a number of questions about the way in which it operated. But just in terms of trying to understand the way in which it was envisaged that it would work alongside the work of SAGE. We've seen some evidence of there being some level of reciprocity agreement and some evidence to the effect that the Scottish COVID Advisory Group would continue to consider materials which were made available to it through SAGE and indeed SAGE's advice, both as regards the intention at the start and regards the practice of the Scottish group. How did its role sit alongside the SAGE infrastructure and including the SAGE subgroups?
When I was appointed to chair the Scottish Government Advisory Group, one of the very first discussions I had was with Sir Patrick Vallance, because to my mind it was absolutely essential that the work of the Scottish group was complementary and completely integrated with SAGE. Although health is a devolved issue in the UK and many scientific issues are reserved, science is global. So it was absolutely vital that the Scottish group interpreted SAGE outputs in the context of Scotland. And in practice, I think that's how it worked. At every meeting of the Scottish group, we would review SAGE papers, and indeed all members of the Scottish group had access to the SAGE paper repository and vice versa.
The inquiry heard evidence in its Module 2 from witnesses, including a political expert called Professor Ailsa Henderson, that there were limitations, as far as Scotland was concerned, on the advice that SAGE could provide, given that its advice was based predominantly on data which was derived from England. Did this continue to be the position as regards SAGE and its subgroups in the period after the Scottish COVID Advisory Group was set up? And if so, to what extent did this reinterpretation of SAGE's position require looking at different data sets from Scotland?
My observation was that from March the 26th, the relationship between SAGE and Scottish participants was excellent. I was a full participant, as was Gregor Smith, Nicholas Steedman, and other witnesses you've heard from, including Jim McMenamin and Mark Woolhouse, who you will hear from, had prominent roles in SAGE subgroups. What I also observed was there was an increasing reciprocity of access to data. And I think you heard from Audrey McDougall, who ran the COVID analytical unit within Scottish Government, and Roger Halliday. And in terms of modelling, there was a sharing of methodology and the application of SAGE methods to Scottish data. So I think we saw a gradual yet constant improvement in that scientific partnership.
Thank you. You mentioned earlier the conversation you had with Patrick Vallance at around the time of your appointment, and your desire, and I think his, to try to make sure that these groups would be aligned. Broadly speaking, do you think that that was achieved?
My view is that that was achieved, and we saw contributions from Scottish colleagues into SAGE papers, which emphasises that alignment.
Structurally speaking, it seemed to us that the Scottish group had certain components which were equivalent to elements of the SAGE system looked at broadly, but perhaps those components weren't as prominent or as significant. There were subcommittees of SAGE, including NERVTAG, for example, the New and Emerging Respiratory Viruses Advisory Group. Was there an equivalent contributor or body to NERVTAG in the Scottish advisory system?
There was not an equivalent subgroup in the Scottish advisory system, but Dr. McMenamin was a member of NERVTAG and was able to feed in latest advice and evidence from NERVTAG into the Scottish group. So it wasn't a complete mirroring of the SAGE system and its subgroups, and actually I don't think that would have been appropriate.
In that regard, however, would you consider that the important advice provided by NERVTAG was able to be fed into the Scottish group through Dr. McMenamin and the access to papers of that group?
I would suggest that is correct, yes.
There were, of course, other subgroups, including SPY-M and SPY-B, and as you said already, there were members of the Scottish group who sat on those groups. Is it correct also to say that the Scottish system didn't have its own subgroups dealing with modelling and behavioural science in the same way, but achieved inputs through individual contributions, particularly from the likes of Professor Woolhouse in the first case and Professor Reicher in the second?
That is correct. And Professor Robertson was also a member of SPY-M.
Yes, so he was another one of the ones who sat across the two groups. SPY-M were involved in I think, the creation and interpretation of modelling. Modelling, I think, in the Scottish system, as we've heard from Audrey McDougall, was done within a unit within the Scottish Government. Is that correct?
That is correct.
And do I understand it correctly that if in its deliberations and in the provision of advice, the Scottish group required access to modelling, that it could access modelling facilities, if that's the right phrase, through this facility within the Scottish Government?
That is correct.
Were there any limitations or difficulties with regard to the accessibility of modelling in the Scottish system?
Not, my view is there were no limitations. The expertise and the work ethic of the analytical unit was exemplary.
Thank you. As regards the way in which modelling was used, in particular, as we're interested in this particular module, to inform advice and ultimately key decision making, could I look at your personal statement, please, up on the screen, paragraph 176? Should come up on the screen in a moment. What you say there relates to modelling. You say, Professor, a key policy challenge we observed was how to communicate uncertainty in exchanges between modellers and politicians. Not only the uncertainty within the models, but also the uncertainty of modelling itself. The C19AG, the group, therefore attempted to convey this uncertainty through illustrating a range of outcomes and probabilities. This cut across normal advice to government, where a single best prediction is often preferred. So you're highlighting here, I think, through experience of the group, that there were difficulties in conveying not only the uncertainty of models, but within the models that you were actually looking at, but also the uncertainty in more general terms of modelling itself. And you came up with this solution. In this regard, and in light of evidence we've heard that, broadly speaking, modelling was an important part of advisory systems in the pandemic for government decision-making, did you have the impression, or did you have any basis upon which to form an impression, as to whether your efforts to try to convey the limitations of modelling and of models had adequately penetrated the thinking of key decision makers?
You should obviously ask that question of the key decision makers. I think a principle of the group, which I reinforced regularly, was the need for clear communication of the knowns and unknowns, and to recognise the limitation of science, including modelling. And most importantly, that the group should expect to inform policy and not make policy. Mm-hmm. Therefore, communicating uncertainty was a key role of the group, of which modelling was one output.
I think in your answer, if I understand you correctly, Professor, you're emphasising, I think, the second part of that part of the sentence where you're talking about the uncertainty of modelling itself. What was the uncertainty with it? What do you mean by distinguishing the uncertainty within the models? What caused that difficulty?
Well, the modus operandi of SPI-M is to work with, I think it's up to 14 groups across the UK who model, and they model independently, but the next step is key. They compare models and they compare the outputs of the models to reach a consensus statement based upon the modelling that has been, the modelling outputs that has been accrued. And I think that's what I'm saying in the first part of the statement.
And when you talk about these difficulties with the models, you've referred that specifically to the models provided through SAGE, but as you've told us a moment ago, the analytical hub also provided models for Scotland, is that right?
That is correct, yes.
And your job, I think, was to try to provide an interpretation of all of that modelling that was available through SPI-M and through the COVID Analytical Hub in Scotland, in order to try to provide advice to the Scottish ministers about your views about matters which would assist them in decision making. Is that broadly the process?
The responsibility for modelling lay within the analytical hub. However, on presentation of the outputs, there was often the presentation of not only the Scottish outputs, but also comparator SPI-M outputs.
Mm-hmm. So the analysis, if you like, of the modelling which you did was predominantly related to the Scottish produced models, but you would refer to SAGE models to assist your analysis and interpretation. Would that broadly have been the approach?
That is a fair representation.
Because,
bearing in mind we had the expertise of people such as Professor Robertson, Professor Woolhouse, who are very expert modellers in their own right and sat on SPI-M.
Thank you. Because if one were to have relied only on the modelling from SAGE, that would run the risk of falling into a similar problem that I think you have given evidence you understood to be in existence before the Scottish group was created, such that one would be looking at models based on English data which might not be applicable to Scotland. Is that fair?
That is fair.
Thank you very much. I'd just like to ask you some questions broadly about the circumstance in which you were invited to become the chair of the group in March 2020 and the group came together. We learned from your statement at paragraph 19 that you were telephoned by the Chief Medical Officer, Dr. Calderwood, on the 16th of March, and she asked you to act as independent chair. Had you worked with Dr. Calderwood before in your government role, perhaps?
I was Chief Scientist Health in Scotland until 2017. Mm-hmm. I think I worked with Dr. Calderwood in her role as Chief Medical Officer for the last 18 months of my tenure.
Thank you. Did you have the impression that the formation of the Scottish COVID Advisory Group, or were you given this impression by Dr. Calderwood, that was part of a strategy on the part of the Scottish Government to try to take a more autonomous approach to the management of the pandemic?
That was not an observation I made.
What information were you given at the time the group was formed about the Scottish Government's policies with regard to its strategy as to how the pandemic was to be managed?
At the time it was formed, please repeat the question. Are you interested?
Yes, I was interested to know whether you were given information about the Scottish Government's strategies with regard to the management of the pandemic in around the middle of March when you were first contacted by Dr. Calderwood.
So I was not, at the time of the 26th of March, I was not given personally any information, but that position changed rapidly during April 2020.
Right. So I'm really just interested in understanding the extent to which the strategy at that time was made clear to you and the members, which would be a matter, I would imagine, that would be of assistance in you understanding as to how that strategy should develop.
My sense is that strategy was emergent and became more clear in the first 2 weeks of April 2020.
Did you understand it in that period, as your understanding grew, what the Scottish Government's policies as regards its exit strategy from the lockdown was?
So the group was asked to comment on the lockdown review framework on the 12th of April 2020. And at that time, the group provided advice onto how long the lockdown should be maintained or whether it should not be maintained beyond the 12th of April. So we were aware of the policy objectives at that time.
And what awareness did you have of the Scottish Government's exit strategy from the lockdown? By which I mean a broad exit strategy. For example, was it we continue with a lockdown until we get a vaccine or something of that nature? Or what was your understanding of the plan?
What I may do is ask for a break in 2 or 3 minutes, if I may.
Absolutely, absolutely.
I wonder whether you were getting a bit... Would you like to break now? And Mr Dawson will repeat the question when we come back.
Of course.
Glass of water, if that's...
Yeah, I think I
Absolutely.
share that feeling at the moment. We'll break for 5 minutes, if that's okay.
Thank you, lady.
I gather the plan is that I leave, but everybody else stays rather than getting lost. Mr Dawson.
Thank you, my lady. Professor, just before the short break, I was asking you, in that early period as the group was coming together, late March, early April, what information was made available to you about the Scottish Government's existing strategy to exit the lockdown?
Yeah. Okay. Thank you. In those early days, the group understood the strategy consisted of 5 things. Firstly, to suppress the virus through compliance with physical distance and hygiene measures. Secondly, to care for those who need it. Thirdly, the need to support people, businesses and organisations affected by the crisis. And lastly, to a phrase I don't like, recover to a new normal by carefully easing restrictions when safe to do so. And finally, to protect against this and future pandemics. I think the development of a vaccine to achieve herd immunity was a medium to long-term strategy. So that was my understanding of the Scottish Government strategy. Our group was invited to provide comments on that, and we made comments and formal advice to the government on the 14th of April, which I can explain the group's advice at that point, if that was helpful.
If you could, that would be very helpful. Thank you, Professor.
Yeah. So at that time, we thought it was, there were 4 or 5 key components. We thought it was important to communicate to the publics that we would be living with this virus as best as possible and that elimination was not an option. Secondly, we emphasised the importance of 4-nation working, that ideally policy objectives across the 4 nations would be desirable. Thirdly, the importance of practical guidelines to support the public, so the behavioural science dimension, including the importance of explaining to the publics the collective nature of the pandemic response, and that we should not squander the gains we've made in combating the virus. And lastly, we highlighted disadvantaged groups. Any new strategy needed to really think through the impact on disadvantaged groups, or people from ethnic minority backgrounds, or homeless people, or people with mental health problems, etc.
Thank you very much, Professor. As far as the disadvantaged groups that you've mentioned were concerned, what material were you given to suggest that an assessment of the likely harms to those disadvantaged groups had been undertaken by that point by the Scottish Government?
I don't think we were given any specific evidence at that time.
Okay. What at that time and going forward, in accordance with your group's broad recommendation that disadvantaged groups needed to be considered, what information or data was made available to you in order to support your assessment of what the harms being caused to them were and how best those harms might be addressed in the strategy?
The evidence was emergent over the course of the pandemic, and a key group which was discussed not only in the Scottish Advisory Group but also at SAGE was the impact, the disproportionate impact of the pandemic on ethnic minority groups. And you may be aware, well, in Module 2, Professor Kamlesh Kunti was chair of the ethnic minority group at SAGE. And we advised in Scotland in June that a similar focus on the acquisition of data to really define the differential impact of COVID on ethnic minority groups was essential.
So before that advice was tendered in June, that data wasn't sufficiently available, is that correct?
I think it was in the process of being accrued, but even today we do not have sufficient efficient capability and ability to differentiate the impact of COVID on specific groups.
And did that data subsequently become available to the group after the recommendation in June, given your observation that it is still not available to the level you would have expected?
Increasingly so. The Scottish Government established it was not related to the Covid-19 group, but an expert reference group on Covid-19 and ethnicity. And that group had the responsibility to look at systematic issues and data issues in relation to COVID in Scotland. It was our recommendation that this was a priority. We didn't execute the work ourselves.
Mm-hmm. The reason I ask it in that particular field, Professor, is that we are in possession of some evidence from a black and ethnic minority support group called BEMIS in Scotland, who tell us that one of the very problems with that ethnicity subgroup was that the data was not available to be able to demonstrate the particular effects of the pandemic and its response on those groups, such that they required to plead their case anecdotally. Is this a phenomenon that you would recognise?
So I'm aware of that comment, and it is something that I recognise, yes. And it was actually highlighted by Professor Kunti in his SAGE subgroup.
Indeed.
Simple things around coding of ethnicity in many ways are at too high a level to be able to make meaningful conclusions.
I think the broad suggestion was that there were a number of ethnic groups that were grouped together in Professor Kunti's work, such that the right response for different ethnic groups was not able to be reached because the data was too broad. Was that roughly the thrust of it?
Correct. Insufficiently granular.
Thank you. And of course, it would be important as regards ethnicity that Scotland's particular circumstances be reflected in local data, because the makeup of ethnic groups in Scotland is different from England and the rest of the UK. Isn't that correct?
That is correct.
To broaden out the discussion here into areas beyond simply ethnic minorities to other, the phrase you've used is disadvantaged groups, would you say that this phenomenon that we've identified as there being a lack of sufficient data to allow a proper analysis of the impact of the virus and the response measures applied to other groups that might be included with that broad umbrella? I'm thinking, for example, of disabled groups or other minorities.
I think this is a broader problem. I agree.
And so in the pandemic response, there was insufficient data to be able to provide proper assessments of the way in which these disadvantaged groups, as you put it, should be dealt with.
That is correct. And that was a component of our advice on the 14th of April, 2020, on the lockdown review.
But did that continue to be an issue throughout the group's continued involvement in the pandemic response?
I think that is a fair reflection, yes.
Thank you very much. You mentioned the 14th of April. There was another thing I think happened on that day. You'll no doubt correct me if I'm wrong. We are aware that over the period before your group was put together, one of the major issues which had affected Scotland was the number of people infected and who died in care homes, but also in people who are cared for within their own home. What was your understanding at the time the group was formed of the Scottish Government's strategy to try to protect individuals at risk in those groups, in particular in light of documents which were issued, guidance documents which had been issued by PHS in the preceding month?
So your question is, what was our understanding of the Scottish Government strategy?
Position at the beginning, and I'll move on in a moment. I know that there was a deep dive meeting that took place in this area, and I'd like to just discuss with you what your advice was as to how it should be developed. But your understanding of the position at the time when the group was coming together in early April.
So our understanding was that there was an epidemic within an epidemic, and that there was a major concerns about the impact of the pandemic on some of the highest risk individuals who are residing in care homes. Our understanding was that a Scottish Government nosocomial advisory group had been convened under the leadership of Professor Jackie Riley, and that they were defining policy in relation to care homes.
Right. I understand that a deep dive meeting led by the First Minister and the members of your group took place in relation to care homes on the 14th of April. Is that correct?
I think that's correct, yes.
If I could just take you to a document. We've struggled slightly to find minutes of that particular meeting or more detailed material. But if I could take you to a document which is INQ 000214740. This is a document of the nature of a nature that we've seen before. It's called in Scottish Government terms, a SCORE SITREP, which stands for the Scottish Government Resilience Room Situation Report. Were documents, did you get access to documents like this on the group, or is this something that you don't recognise?
I do not recognise this specific document.
Okay, but did documents of this nature, these situation reports, were they made available to the group or not generally?
I think you will know we had 11 so-called deep dives with ministers when papers were being prepared and generated by the group. Mm-hmm. We were given access to those papers, but I'm not familiar with this paper.
No. Just to be clear, this is a paper which is generated not for your purposes or by you. It is dated the day after, you can see from the top right-hand corner, the day after the meeting to which I've referred. It is a document which contains a vast array of information that was presented to SCORE, which you'll be aware is part of the Scottish Government decision-making resilient structure. I simply wanted to take you to page 19, please.
It's coming up.
Thank you very much. Excuse me just one second. You can see, I hope, Professor, there's a big box in the middle which is entitled "What is being done," and a passage has come up which says an FM-led deep dive on care homes was held on the 14th of April. An action plan is being drawn up urgently, including the interim CMO letter to care homes, improved information flows, an enhanced focus on prevention and more support for care homes, for example, on staffing, PPE and testing. In discussions between FM, CABSEC and interim CMO, it has been agreed that while it may not be clinically required for public confidence, we will move to a system where any symptomatic patient in a care home will be tested. We know that an announcement was made subsequently on the 21st of April that a number of different measures will be put in place with regard to care homes, including the requirement for someone to be moved from a hospital to a care home for them to have 2 negative tests, and various other supervision requirements, including an enhanced role for the care inspectorate. Can you assist us, as we are somewhat short on precise information about the deep dive meeting? Is this a deep dive meeting that took place with your group?
That's the first time I have seen that document, so I cannot comment on that document.
Of course. I'm simply asking, I'm trying to use this document to help you orientate in your memory as to whether I don't have any better documents to give you, I'm afraid, Professor, but I'm trying to work out whether a deep dive took place with your group on the 14th of April to discuss care homes.
The first deep dive I was involved in was on the 8th of May, which was a contact tracing deep dive. Okay. So I did not participate. So that's why I was looking slightly.
Not at all. It's a mystery we're trying to solve ourselves, Professor, so thank you for your assistance. We'll move on then, if that's not a matter with which you can help us. Again, asking you a question about the period when the group was being put together, what was your understanding of the Scottish Government's strategy at that time with regard to the management of a possible second wave of the virus?
My understanding was the Scottish Government strategy was to break chains of transmission through test, trace, isolate and support policy. Secondly, to protect healthcare workers and continue to manage the epidemic within care homes. Thirdly, to enhance constant surveillance and population and sharing of data in real time. Continue with the NPI measures and maintain clear and honest communications with the public, including transparency of risk level, and to use lockdown sparingly. And the anticipation was that the above strategies would buy time to enable the vaccine developments to achieve population immunity through vaccination.
Thank you. Could I just ask you, that there are a number of references in Scottish Government materials to the COVID advisory group. They tend to call it the CMO advisory group. And obviously, as we know, it was set up and you were appointed as chair by Dr. Calderwood. What role did the CMO play in the meetings? In particular, what was the CMO's role in understanding and discussing the advice of the group, and then subsequently conveying it to ministers to assist in their decision making?
The group was established to report through the Chief Medical Officer to Scottish Government ministers and officials. The CMO himself, I think Dr. Calderwood attended 3 meetings of the group, and I think Professor Smith attended 32 meetings of the group out of 60 in total. There was always a member of the CMO's office at every group meeting, for example, a DCMO. Advice was always submitted through his office for further dissemination across Scottish Government.
Thank you. Professor Smith gave evidence to the inquiry yesterday, and he explained that the CMO's role is as principal medical advisor, and that in that role, while he held it, and in the role, as is the case with his predecessor, he provided direct advice to key decision-making ministers. Does the fact that he failed to attend the 3rd, 4th, 5th, 6th, 7th and 8th meeting of your group, should that be taken to indicate to us that he was insufficiently engaging with the expert advice of the group, which had been formed up by his predecessor?
There are multiple demands on the CMO's time. I endeavoured to ensure that following each meeting, I would have verbal communication with the CMO to update him on the group's current thinking and advice.
The group contained a wide variety of experts in various different fields, isn't that right?
That is correct.
And in order to engage with that expertise properly or appropriately, it would have been necessary for the CMO to have attended the meetings and listened to the views and expert opinions of that wide variety of experts, would it not?
You could conclude that, yes.
Thank you. As far as the membership is concerned, we have a list of the members, and I've been helpfully provided with statements from the perspective of a number of the members. As regards the selection of the membership, was the membership selected by Dr. Calderwood, by yourself, in consultation? What was the process that went into selecting the members of the group?
A draft membership was compiled by a deputy director, Ms. Niamh O'Connor, in discussion with the Chief Medical Officer and the Chief Scientific Advisor, who at that time was Professor Sheila Rowan. A draft list was then submitted to myself and the CMO and the Deputy CMO, Professor Smith, for comment. I only made one addition, who was suggested addition, Professor Sir Aziz Sheikh, and I understand the CMO recommended Professor Devi Sridhar join the group, and the Deputy CMO recommended Dr. McMenamin join the group. key was an interface with the Scottish Science Advisory Committee, which was an established advisory structure in Scotland.
Were there other, although there is a wide range of academic specialities represented, public health, epidemiology, microbiology, behavioural science, your own role in data, Professor Sheikh's role in research, etc., including a number of representatives of key public health bodies and the medical advisors to the government. Were there any other areas that you felt would be beneficial to have represented in your important work?
My reflection is the group was well constituted and was manageable in size. So I thought that in terms of the disciplines represented, it was good, but I always encourage group members to look out with their own specialty and also out with Scotland, so that we derive the best scientific evidence and information possible.
The inquiry has heard significant evidence that health pandemics can be expected to have a greater impact on those who suffer from pre-existing structural and health inequalities or the most vulnerable in society. Did you consider having members of the group whose expertise was predominantly in those areas and who may have been able to have provided a perspective which the data perhaps could not on the way in which the pandemic and its response would affect these groups?
I think that is a very valid comment. Not specifically, but I would comment that Professor Carol Tannehill, who at the time was Chief Social Policy Advisor, has a significant track record in inequalities.
There was no independent representative out with Scottish Government, however, who provided that expertise.
That's correct.
Thank you. You very helpfully tell us in your statement, paragraph 195, I'll just read the short passage out, that ideally the rapid assembly of the group would have been part of a mature and pre-existing advisory structures with deep integration across the four nations. Are you reflecting in that, Professor, your view that it would have been better had a group of that nature existed before, as it takes time for a group performing such an important role to embed itself and therefore perform its function to an optimum level?
I think that is a fair reflection, yes.
Did you at any time during the course of your important deliberations have access to any information with regard to the position of patients or families of those who had been infected or had died from COVID?
We did not. We were constituted as a scientific advisory group.
Would insights and access to such material have been of assistance to the group's deliberations?
I think it would, yes.
Thank you.
A key is that we had frontline clinicians on the group who actually provided relevant commentary, expertise, and relationships that were valuable in the group's discussion.
Those frontline clinicians, however, were not intensive care doctors or respiratory medicine specialists working at the coalface, if you like, of the response, were they?
Yeah. Tom was, yes.
Tom Evans, perhaps, of University of Glasgow.
Yeah.
Thank you. I think we're due to take a short break now, Professor.
I just wanted to check. A, would you like a break, Professor? And B, if we have a break, do you think you could survive another 25 minutes or so? Please be honest.
I'm here to serve, so I'll do my very best.
Thank you very much. Right, 5 minutes. Mr Dawson, we'll finish at 4:45, come what may. It's not fair on the Professor.
Absolutely. I can assure you, Professor, not much further to go. Just a few more questions. I'd just like to ask you some questions about some of the operational aspects of the group of which you were chair. The first relates to the fact that we are aware that in addition to the advice provided by your group, the Scottish Government received advice from numerous other groups on other policy areas relevant to the COVID response. This manifested itself perhaps most obviously in the period when, in the summer of 2020, when a number of groups were formed, including the group to which you've already made reference, the group dealing with matters pertaining to ethnicity, but there's also other groups which provided advice on other aspects of the pandemic and its effects, including economic and other groups. Your group had a number of subgroups which looked at particular aspects of the area in which you had an interest. As far as the groups from other spheres were concerned, would it be correct to understand that your group did not have access to those groups, either in the sense of their recommendations and input, or indeed actual opportunity to discuss the broad response with those groups?
That is correct.
There has been some commentary, including from certain members of your group, that it might have been beneficial to be able to understand that, given the fact that the ultimate task of balancing the various harms, to put it in Scottish Government language, then fell to ministers, which occurred out with the presence, if I can put it that way, of these expert advisory groups which had been put together for the purpose. Would it have been beneficial, do you think, to have had some level of access to what other groups were saying, so as to be able to provide, from your group's perspective, any input you felt you could to assist with the balancing of the various and at times copious evidence received by Scottish Government decision makers?
I personally subscribe to coordination and connectivity of scientific advice. Our group was focused very much on trying to quantify and provide advice on the first two so-called harms. During a pandemic, it was also essential to try and quantify the impact on harms 3 and 4. So I think that convergence of advice givers would have been advantageous, yes.
It's quite clear to anyone wishing to look, Professor, that the group was an expertly constituted group for the purpose of contributing advice in respect of harm 1, namely the harm of the virus and its control. However, you mentioned also that it provided some element of role relating to harm 2, which you will recall related to non-COVID harms, health harms. Was your group really in a position to be able to provide advice on that aspect of the pandemic, or would that more appropriately have come from other spheres?
Partially. For example, in some of our advice to government in relation to relaxation of restrictions, we provided advice on opening up cancer and other services. So partially, but not predominantly.
Thank you. We discussed with Professor Sridhar earlier the period over which she provided advice either through the group or more directly to decision makers. And in her evidence, she suggested that given that her focus had been predominantly on harm 1 and an attempt, as you were, to try to minimise and lessen infection and minimise the harm of harm 1, that her predominant role in that regard, she felt, came to an end towards the end of 2020, and that the arrival of a vaccine started a different level of approach on the part of the Scottish Government. It seemed to us that your group met frequently in the period up to May 2020, but started to meet much more infrequently as the pandemic progressed. By, I think, 2021, there were relatively infrequent meetings, other than in December 2021, where a few meetings were convened to discuss the Omicron threat. Was it your impression that the influence or importance of your group waned in the period from the summer of 2020 onwards, despite the fact that the pandemic continued to rage in Scotland?
That was not my observation. The group was constituted to serve the need of policymakers and ministers. And what I would propose is that the knowledge base and the learning and understanding of key components of the pandemic response was learned within government and civil service departments. So it was a knowledge transfer, which in many ways is a good thing.
Such that by the latter half, if I might put it, of the pandemic in Scotland, your group was no longer required. Is that what you're suggesting?
No, I'm not suggesting that. But our advice was to provide expert advice independently to government, and the frequency of that advice did change over the course of the pandemic.
Thank you. As regards the way in which advice was commissioned, I think you tell us in your statement helpfully that sometimes advice was specifically requested on aspects of the pandemic. For example, as you've said, you gave advice in connection with the extension of the lockdown in early May of 2020. But at other times, you suggest that advice was provided by SCAG on its own initiative. I wonder if you could help us with the relative balance between advice provided on request and advice provided on the initiative of the group, and in particular areas, if you can recall, where advice was provided in that latter category.
Yeah. So the group provided 40 formal pieces of advice to government. I would suggest that at least 70 or 80% of those pieces of advice were commissioned. Examples where there was a spontaneous piece of advice would include, for example, the advice on Black and minority ethnic groups, which we touched upon earlier. Secondly, a paper in August 2020 on risk and risk communication, because we thought that was a key facet of the pandemic, which would be very helpful to policymakers. And finally, a submission on testing very early in the pandemic. So I think it was about 80% commissioned, but there were at least 8 examples of advice where it was spontaneously generated by the group. Thank
you very much. I think in passing, we mentioned earlier the period of the summer of 2020. There are a number of documents which deal with the issue of a subject we have an interest in, which is broadly defined under the banner of zero COVID, or the possibility of eliminating the virus. The group provided a number of papers and considered this issue in a number of places, including in an advice paper under the subtitle Long-Term Strategy, which for the purpose of the transcript is INQ 000217685, where it said that there is a need for greater overall clarity as to whether the approach that the government is pursuing is still one of containment or elimination. Clarity as to what extent our approach will continue to be broadly aligned with that being pursued by the UK government is important, as elimination would require UK-wide strict border controls, currently centred on self-quarantine. These would be needed for arrivals from every country with Covid-19, likely to be a large number in the foreseeable future. The group considers this cannot be a Scotland-only aspiration, and that the aim is to suppress the virus to as low a level as possible. There are also some minutes from a meeting which took place on the 13th of April, which again, for the benefit of the record, is INQ 000217503, in which there is reference to there having been a minority view of the group that a zero COVID approach, the objective to eliminate the virus, not merely to suppress it, should be considered. And it states that, however, a zero COVID strategy in Scotland was unlikely to have been sustainable because of essential travel to and from Scotland, consistently with the other paper. Can I take it then, Professor, that the view of the group that a zero COVID strategy defined in that way was unattainable in Scotland given its circumstances?
That is correct. I had the privilege of challenging, I had the privilege of convening a group with a great diversity of scientific viewpoints. And that is a good thing when a new challenge arises. However, I think we've explicitly stated there that a minority view on the group was that zero COVID might be attainable. Majority of the view of the group was that maximal suppression was the only viable strategy.
Do I take it that the minority view was represented by Professor Sridhar?
You may conclude that, yes.
Yes, she's given, we've heard evidence from her just today about her views on that. I'm interested in knowing whether that minority was a minority of one or whether there were others who were of a similar view to her.
From recollection, it was a minority of.
Thank you. Did you have direct access via messaging or emails or phone calls to ministers who made decisions about the pandemic, including the First Minister?
Did you use the word informal there?
I'm talking about any means by which, I'm using informal to try and include a number of different possible ways of communicating, but I wish to include phone calls, emails, text messages and the like.
When we established this group, I was very keen to remind members that our job was to inform policy, not make it. And I was also very clear about how we should interact with colleagues. So the 5 ways which the First Minister may have seen outputs of our group were firstly the response to commissioned advice, secondly the advice on our own initiative, thirdly the comments we made on policy documents before publication, fourthly, the deep dives. So I would chair the deep dive meetings with the First Minister and the Cabinet. I chaired 11 of those, of which the First Minister was present at 9. And lastly, I provided an informal SAGE update after each SAGE meeting. I had no other direct contact with any minister.
Do I take it from what you said that you were keen to counsel members of the group that in order to maintain independence, that those methods that you have mentioned should be the only means by which their advice be communicated to ministers?
That was my recommendation. And I remember at the first meeting of the group, I suggested we should be useful rather than famous, because the blurring of science and policy can be unhelpful.
Thank you. Were you aware, while you chaired the group, of any of its members having any such direct communication routes to ministers?
No, I was not.
Thank you, my lady. Those are the questions which I have for the Professor.
Thank you very much indeed. Thank you so much, Professor. Thank you for all the work that you did and your colleagues did during the pandemic, and thank you for enabling us to stick to our timetable. I do hope you recover soon and you don't suffer any long-term consequences. Thank you very much indeed.
Thank you, my lady. Thank you.
Right, so it is 10 o'clock tomorrow?
Thank you, my lady.
Thank you.